Good morning and welcome everyone to this week's Insight and AppSAD webinar. Thank you very much for everyone who has joined us so far this morning. Before I begin, I would like to acknowledge the traditional custodians and owners of the lands and waterways upon which we're all meeting today and joining this particular webinar. I'm in Deakin, which is the Indigenous Australian name for Brisbane on the lands of the Turrbal and the Yugara peoples. So I'd like to pay my respects to elders who have passed on and for those elders who are leading today, and also extend that acknowledgement to any First Nations people who are joining us in this webinar from across Queensland and Australia today. So welcome. And look, it's my pleasure to welcome back, not just welcome, but to welcome back Dr. Travis Harries and also Dr. Ashlee Curtis, who are coming to us from down in Melbourne today, where I've been told reliably that it's a beautiful day down there, as it is up here in well, this part of Queensland anyway, as well. I'll introduce them in a few moments' time, but just to let you know, with our webinar today, how we'll proceed with this is obviously in a few moments' time, I'll hand over to our wonderful presenters and and thank them as well for their generous time in advance. During the session today, if you have any questions or comments that you'd like to make, please pop those in the chat. And just to let you know that that chat does come to hosts and panelists, so it won't be seen by everyone, but certainly it'll be seen by us. So just to let you know, if you don't see it pop up in your chat feed, it is definitely getting to us. And we'll try and collate as many of those questions together to be able to present to Ashlee and Travis by the end of today. So look, without too much further ado, to introduce our wonderful speakers today. So Travis is a lecturer in psychology at Deakin University in Victoria, and he's a member of the Connect Research and Training Initiative, just one of the things that he's involved in, which is in the Centre for Social and Early Emotional Development, which is the acronym you'll see on the screen there at Deakin for SEED. And his research area is primarily in family violence, with a specific focus on child-to-parent violence, which is, and also parent-directed aggression. And our subject, as you'll see today, is very much in that kind of space that Travis works, which is around substance-involved child-to-family violence. And also joining Travis is Dr. Ashlee Curtis, who's a senior lecturer within the School of Psychology, also at Deakin, and is the stream leader of the Experiences of Harm in Vulnerable Populations group, which also sits within that same training initiative of SEED. And Ashlee's research focus is on the factors that impact aggression and violence across the lifespan in community, clinical, and forensic settings, including things like substance use, trauma, and neurocognitive impairment. So some great experience to bring to our community today to be able to value add to the work that we all do. So look, without any further ado, I'd like to hand over to you, Ashlee and Travis, and yeah, thank you very much.
Thanks, James, and thanks everyone as well for having us here today to talk about what we certainly think is a really important topic, which is child-to-parent violence, and specifically today we'll talk about that which is substance involved. I'm going to jump straight into things because we don't have an awful lot of time to say what we need to say, but we'll get to a specific definition in a moment. But for the time being, child-to-parent violence is pretty much what it says on the tin. This is instances where a young person is aggressive or violent towards their caregiver, and that can be across within childhood, and we'll speak about adolescence and young adulthood today. It's actually a relatively common experience for a lot of Australian families, and it's even more common internationally as well. And that's often surprising for people to learn because it's not as regularly spoken about as other forms of family violence, but it's sort of massively neglected in that way, and because of that, it's pretty misunderstood. A lot of our current understanding is actually generalized from adult intimate partner violence knowledge, which is not really appropriate for young people considering their developmental stage, but also their dependence in the relationship. And at face value, it doesn't seem to be sensible. So developing this better understanding of child to parent violence is actually a specific point um, or a specific point of action, I should say, within our national strategic plan to end family violence. And this is because we know that when young children and adolescents use violence and aggression against their parents in early life, if we don't intervene, then this can generalize into their early dating relationships, but also into their adult intimate partner relationships as well. So a few years ago, we actually presented here on alcohol in family and domestic violence more broadly and the harms associated with this. And we spoke a bit about intervention options as well. Addressing this child to parent violence is one really promising way that we can prevent a lot of this harm from becoming intergenerational and continuing. And so Ashlee and I, we lead a large program of work into developing more tailored understanding of child to parent violence and one that's more sensitive to child development, but also acknowledging that a lot of their behavior is influenced heavily by that broader family system that they're developing within. So we're going to share with you today and talk about a small part of the work which is relevant to your area, and that's a couple of studies that we recently published in um, Drug and Alcohol Review that explored child to parent violence that's substance involved. And I'll talk about what I mean by that in just a minute. And so for some high level context, this is a definition of child to parent violence that we refer to in the research space as a consensus definition. And this has actually been quite problematic for a lot of reasons and created a lot of gaps in our understanding of the role of substance use in child to parent violence, which is why we're quite behind the eight ball compared to other forms of family violence and understanding the role of substances there. You can see by the bolded part of this definition that instances of child to parent violence where there's intoxication or withdrawal present are not actually considered within this definition. They're actually specifically excluded. There's lots of other challenges here, but that's the one that's sort of most relevant for today. And while there are a handful of studies that looked at substance use and its relationship to child to parent violence, it hasn't been a focus of risk assessment or intervention, and it doesn't really tell us about the role that substances are playing in incidents of child to parent violence and how it develops and becomes an ongoing problem for families. And that is really because no one is considering um, how substances are involved right now, only that there is an association currently between substance use and the use of child to parent violence. But those are quite different things. Um, we're actually one of the studies that we're conducting right now is a meta-analysis on the association between substance use and child to parent violence. So we're taking or we're looking at the size of the relationship between those two factors. And what we've found so far is that on average, there actually seems to be a relatively small relationship between mostly physical child to parent violence and substance use. We're still looking at this in detail, but even though that effect is small, it's massively consistent across studies, which tells us that substance use has an important role to play in child to parent violence that needs to be considered and further understood. And this is, of course, consistent with broader literature on aggression and violent behavior as well. And so the reason why, which will probably come as no surprise, but the reason why substance use is important to consider in how we understand children's use of aggression towards their parents is because it increases or it can increase both that likelihood of conflict turning into aggression, but also the severity of that aggression when it happens. And so because of that, it's a pretty key risk factor to address for the young person and for the family more broadly. So on that first point, there's been a really substantial amount of research that's demonstrated, and this is both experimentally and using other methods as well, and over about 30 years, that when people are intoxicated, they can become aggressive when they otherwise wouldn't if they weren't intoxicated. Now, of course, not everyone who uses substances is going to become aggressive, and different substances have different effects, of course. But given the right mix of factors, we know that this can occur and it can contribute. And I'll get into a bit more detail on that in just a moment. Um, just specifically, for example, there are studies that show that when we give people alcohol and get them to participate in a competitive task, they become more aggressive than their non-intoxicated peers in that study. There's also longitudinal research, so research that follows people over a long time, the same people, and this also finds uh, direct links between substance use and their future aggressive and violent behavior. Um, and we have about 30 meta-analyses now on that point that have investigated this link, and they're covering about 800 relationships that have been observed. And they all show this positive association between alcohol use, mainly alcohol use, but other substances as well, and violence. We also have a handful of studies that demonstrate that substance use can increase the severity of aggression. So, for example, that aggression, when it does occur, being more likely to cause injury. So, for many substances, there's related changes in the brain that mean individuals, they're less likely to stop the aggression once it's started, and they're also more likely to go further. I'm just going to hand over quickly to Ashlee to talk a bit more about that.
Thanks, Travis. So, I want to talk a little bit about the developmental context around substance use and why this is important for us to consider in relation to child-to-parent violence. So, our research so far on child-to-parent violence, as well as the research we've done more broadly in adult populations on substance use and aggression, does tell us that there are lots of important reasons that we need to consider the role of substance use in instances of child-to-parent violence, so that in the moment considerations, how substance use plays a role in the actual behavior in the moment, but also more broadly around how substance use is impacting on the child or young person's development. And that includes the child's own use of substances as well as the parent's use of substances, and how this then creates a broader risk for aggression within the home. And so we know that the adolescent years are really important for all kinds of development, cognitive development, mental health, psychological development, and social development. And the research tells us that substance use during this period of time is very disruptive to all of these areas through different mechanisms, but all of these areas then in turn are really important for development of appropriate behaviors, learning how to manage emotions, and learning how to be a social person. And so, in terms of cognitive development, we know that substance use interferes with the structural and functional development of the brain. And so, specifically, substance use impacts largely on the prefrontal cortex. And that is the area of our brain that we need to be working really well because it's responsible for attention, memory, executive function. So, it helps us make good decisions. It helps us to control our impulses and to learn information. So, if we have substance use over a long period of time or acute substance use, some of those cognitions or cognitive factors that we need are not going to be working in the way we need them to be to make good decisions. Regarding mental health of the young person, again, early and more frequent use of substances is associated with higher rates of anxiety, depression, conduct problems. Substance use can also mask underlying emotional difficulties and can lead into a cycle of dysregulation, which increases vulnerability for the young person for later mental health concerns, but also that lack of ability to develop emotion regulation skills over time means that As they move on into adolescence, into adulthood, they don't have skills or the ability to regulate emotions when there are stressful situations. So this disruption occurs not only in the moment, but over time and feeds back into itself, where if we don't keep developing those skills appropriately, then they won't develop. Third is then for social relationships. We know, again, that substance use can create conflicts with family members, with friends. It disrupts how people act in relationships, how they view relationships, and therefore it's having a really important impact on how people learn to be in a relationship and what's appropriate for resolving conflict and communication as well. And what's really important here is that all of these things play a really key role in aggressive behavior. So we can start to understand the mechanisms by which substance use might be having an impact on child-to-parent violence. But again, the literature base here is behind. And so a lot of this we are still trying to establish within this population as well. So despite there being quite a small literature base, as Travis has touched on, we know that within the literature that does exist, substance use has been identified as being relatively common for people who engage in child-to-parent violence. So these statistics on this slide are all Australian-based, so they give us a good understanding of what's happening nationally. The first two dot points are focused on justice or police samples. And what we can see is that up to about 28% of those samples where people have engaged in child-to-parent violence, there is reported substance use involved in that instance of violence, and up to about 8% for substances or drugs in this case. And then we, in our own research, have measured the prevalence of substance-involved child-to-parent violence, and we found that around 25% of parents report they've experienced substance-involved child-to-parent violence. What's important to note here, particularly, at least with our research as well, we often ask parents to report on their own experiences of child-to-parent violence from the young person. And so these statistics are probably an underestimate of what's actually happening and would be different if we asked the young person if they were actually using substances or at what level they were using substances. And this is the case for lots of the literature in child-to-parent violence. It's very much based in parent report, which makes sense. It's much easier to get the information from parents, but it leaves another gap for us, which is really understanding the substance use from the young person's perspective as well. Another important thing to note is that given this proportion of young people reporting substances involved or parents reporting that they're experiencing substance-involved child-to-parent violence, it seems like it would be really important to target in treatment and intervention, but what we see is that it's typically not considered in existing interventions, at least in the literature. We know that there are people doing work in this space that maybe is not being translated into kind of the research evidence. But it does tell us that this is probably an important risk factor that should be assessed or potentially should be included in interventions to improve the effectiveness of current interventions. So as Travis noted earlier, research has consistently shown us that aggressive behaviour and substance use are related, and that aggressive behaviour is often exacerbated by the acute impact of substance use. And we see this happen in many different studies. And substance use has this effect in lots of different ways. One way, for example, in terms of intoxication, is that substance use impacts on your ability to focus your attention. And so because of that limited ability, you can only focus on the most salient or novel things happening around you. And that might be, in this instance, somebody bumping into you. And so in this situation where you're intoxicated, it's very difficult to use the parts of your brain that you need to make good decisions, to think through alternative ways to cope, to problem solve, because they're all offline, because the intoxication has impacted on that part of the brain that's needed to engage in those processes. And so in instances like that, there is an increased likelihood that aggression will occur. Another impact can be looked at from a more like chronic perspective. Chronic use over time impacts the way the brain develops, but it also can impact on the structure of the brain, which then in turn impacts how the brain functions. And as I've mentioned, and Travis has mentioned, this is particularly relevant for the part of the brain we need to make good decisions, to inhibit behavior, to not be impulsive, to think through consequences. So you can start to see how we would expect then that substance use would be having this really key role in aggressive behavior. And another important thing to note around that is that recovery from chronic substance use can take a really long time. We know that for some people who have been dependent on substances, it can take up to a year for the brain to recover to where it was prior to dependent use. And so even if you've got a young person who's been using substances for a really long time, but they've stopped, there is likely to be an ongoing impact on the brain, and therefore the risk of aggression and child-to-parent violence occurring is still there. And so it's just another thing that we need to, at least in our research, we're considering, but also is important to consider in practice as well. And I guess the other side of this that's really important is that cognitive function and this particular prefrontal cortex part of the brain is really important for intervention in terms of being able to actually engage in intervention effectively. So not only is substance use creating risk around aggressive behavior, but it's also then an issue for how they respond, or people respond to intervention. If you don't have those higher order functions available to you, it's very hard to remember what you've learnt, to apply it to different situations, to actually engage in that thinking when you need it. And so there is also an intervention impact as well. And so I guess just using an example, if we think about how all this kind of comes together, you've got a person who's intoxicated or they've been using substances chronically, they're going to find it really hard to make decisions. And so they might opt for risky decisions that give them instant gratification and reward. We know that system in the brain is very impacted by substance use. So we know that's probably happening. Then if you've got difficulty thinking through the consequences of your behavior, your inhibitory control, your ability to actually stop yourself reacting to something really quickly is lowered because of the impact of intoxication, then it's very, very difficult to inhibit your aggressive responses, particularly if there's other factors contributing to that, like vulnerabilities you might already have. And Travis will talk about this a little bit more in an applied example soon. And I will pass back to Travis.
Thanks, Ash. So I just want to take a step back. So we just sort of covered, the acute and chronic effects of substance use for young people and how that's directly or indirectly impacting on their aggression. But obviously, there's a bigger sort of picture here to consider. And so the research we're going to report on in a moment, I promise we'll get to the actual research, is concerned with trying to understand, when child-to-parent violence, specifically that substance involved, is more likely. And generally, there is a coming together of three different types of factors that make aggression more or less likely at any one time. And it's a great way to start to think about what's playing out when we see aggression under the hood, because we can become fixated on behavior itself a lot of the time, particularly with aggression, where it's obviously a big safety risk. It's very confronting. It's hard to think about what else is happening, but it is more complex than that. So first, we think a lot about what we call instigating factors, and these are things. They're often things in the environment, from the perspective of the young person, that trigger that potential use of aggression. So it could be a particularly harsh attempt at discipline from the parent, or even it could just be that the young person perceives that the parent is being harsh, regardless of whether they are or not. Instigation can also come from within as well. There's a temptation sometimes to relate instigation to blame, or to identify who should take accountability, which happens a lot in our family violence interventions. But this is not necessarily the point. The point is to understand more agnostically what's that proximal kind of flashpoint for the incident. We can consider what we call impelling factors, and these can be state or trait factors that increase the likelihood that aggression will be used in response to that real or perceived instigation. So, for example, if a young person has experiences of trauma, or which is massively common in this population, almost 100%, or perhaps in that moment their regulation system is very close to reaching its limit, then the likelihood of an aggressive response to an instigating factor is increased. But that's not always enough. We know that in some cases there's an opportunity to override an aggressive response before it happens, which is why what Ash just spoke about is quite important. And we refer to these as inhibiting factors, and they work against those impellers to reduce the likelihood that aggression will occur in response to instigation. So, for example, and I've just seen a question pop up about proactive aggression, and that relates to this kind of instigation stuff, and we can get to that in a moment. But for example, if a young person has really well practiced regulation strategies, or perhaps the parent can recognize what's happening early, be responsive to the escalation that's occurring, then aggression can be avoided, even if there's really strong instigation or really strong impellence. And so within this model, right, really, really serious and severe aggression occurs in the event of what we call a perfect storm. And this one's actually pretty straightforward. If instigating factors are strong, if our impelling factors are strong, and our inhibition is weak, then aggression is likely, particularly more severe aggression. But if just one of these factors is mitigated, the severity and the risk is reduced. And this is where the impact of substance use in this broader picture is really, really important. So we know many of these substances have a disinhibiting effect on our behavior. They make it less likely to override our responses, our impulses and our responses. In situations where there's no substance use, even if there is conflict, even if there's an opportunity for aggression, maybe one of the individuals also has a history of violence, that inhibition, can still remain high, and it can offset either the severity or even just the risk at all for aggression. But all these factors are the same with the introduction of substance use, which creates that weaker inhibition. Then we have this sort of perfect storm for an incident of aggression, in this case, child-to-parent violence. And so this is sort of that theoretical thinking, that foundation for a couple of studies that we published in Drug and Alcohol Review, and that I'm going to sort of touch on our results from those now. And these studies, we sampled a relatively small but really specific group of parents. Once we reduced our sample to who we wanted, we had about 120 parents who were experiencing child-to-parent violence either in a severe way, so they're experiencing ongoing physical aggression from their child, or their adolescent in this case, or alternatively, it might have been less severe, so verbal. I say less severe, in a tentative way, mostly verbal, so shouting or insulting, but they're experiencing it every day. And we asked them to report on their adolescents or young adults, basically those who were eligible for youth services, on a range of different factors that I'm going to explain the logic behind in just a minute. We'll skip over that boring part for now. So Ash, can you just bring up each of those on the screen? Thanks. So these studies that we're going to report on, they're really the first in the literature to introduce and I guess systematically study substance-involved child-to-parent violence. As we mentioned, most studies up until now have considered it as sort of a relationship between substance use and aggression rather than considering instances that are substance involved. And because of that, we really weren't even sure if parents would report any of it at all. we suspected that they could identify it because it sometimes emerges as a theme in qualitative interview type research. We just couldn't be confident that the prevalence was high enough to actually show up in a small sample. So in terms of how we measured it, we kept things very broad and based on so that substance that cycle of substance use. We asked parents to report on how often their experiences of aggression from the child um, happened when they were noticeably, this is the child, happened when they were noticeably under the influence of substances, where the parents suspected that they might be coming down from their use, as well as withdrawing or abstaining from their regular substance use. And we know that each of these stages impact on the individual in ways that could change the aggression or increase its likelihood, just in slightly different ways. As Ash mentions, it's important to keep in mind that this is parents reporting on their children. And some parents will be more able to do this than others. In a perfect world where we had more resources, we would love to sample both parents and their children and sort of triangulate those responses. And that's something that we intend on doing at some point in the future. Next slide, please, Ash. Thanks. Um, so we used this model that I went through before to try to think about why some dyads, some parents and their children may experience child-to-parent violence that's substance involved when others don't. So I'll take you through that general theory that we tested and what our thinking was. So firstly, we know that adolescent substance use, it normally doesn't occur in the home. And so in order for that young person to engage in substance use, which is obviously a pretty important prerequisite here, that young person needs to be afforded some sort of opportunity to do so outside of the home. And typically this would occur in the context of less monitoring behaviors by the parent. They're generally less aware, less in control of where the young person goes and what they do, and this gives them more opportunity to use substances. Then, based on other research, we suspected that a lot of substance-involved child-to-parent violence might be triggered within a situation where there's a discipline or boundary setting attempt from the parent when they discover that the substance use has occurred or is occurring. And so think about who might be more likely to discover evidence of substance use from their children or adolescents. It's likely to be parents who are what we call more intrusive than others. And this is a terrible label, but it essentially means that they're more likely to go through the young person's things without them knowing and not extend privacy to the adolescent that's developmentally reasonable. We know that this is a risk factor for child-to-parent violence generally, but it might be particularly relevant in this substance-involved context. And so we thought that this combination of lower monitoring and higher intrusiveness would in effect contribute to some instigation to the equation. I just want to quickly flag that there's a lot of reasons why parents might display these behaviors. We're certainly not suggesting it's some kind of moral failure. This could be due to ongoing intimate partner violence in the household, past experiences impacting on their capacity to provide responsive care as well. And so we then thought about what might impel substance-involved child-to-parent violence once there's some sort of opportunity or instigation kind of presented. And we thought that where the young person has higher levels of what we call affective reactivity, which is essentially higher trait or stable levels of frustration and anger, again, which could be related to a range of things, we thought that they would be more likely to respond with aggression, particularly when influenced by substances at that time, which brings us to our inhibiting effect, those substances offering that disinhibition to some of that ongoing frustration. And what we modeled statistically was that all of these factors would interact cumulatively to increase the risk of substance-involved child-to-parent violence. And this is in a sample where everyone's experiencing child-to-parent violence. We didn't suspect that one factor alone would really explain much of anything. So we were kind of modeling this perfect storm that I spoke about before. I'm going to keep the messaging really clear here. Obviously, you can consult the paper if you're interested in the actual statistics. So take our word for it now. What we found broadly was some support for a couple of parts of what we thought, which is it's always the case. We found that compared to families experiencing CPV, child-to-parent violence, that was not substance involved, families where the parents had less knowledge and control over their child's behaviors and whereabouts were more likely to report child-to-parent violence that was substance involved. And what we found as well was an interaction effect where this was particularly true. That relationship was much stronger when the young person also was highly temperamentally reactive. So they had lots of anger and frustration. And again, the important thing to consider here is this is in a sample where all families are experiencing substantial and ongoing child-to-parent violence. This is not compared to a control group. So levels of both of these things, that sort of that poorer monitoring and a higher reactivity, were already high. And so the conclusion is that they are especially high where the child-to-parent violence is more likely to be substance involved. Now, this, of course, we can't say that this is causal in any way. There's lots of alternate explanations here that may explain what we found. So, for example, it may be that the substance use itself is actually generating a lot of negative emotionality or contributing to it in the young person. It may be that the young person is using substances to cope with or to self-medicate an overwhelming amount of frustration and anger. It's probably both that both are contributing realistically. It's also perhaps the case that the parent has reduced their monitoring behaviors, their control over the young person, because they know that doing so is going to put them at risk of even greater aggression and harm that they and that they have to act on the knowledge that they gain about the young person and about their substance use. What we didn't find that we thought we would was we expected that parents who reported substance-involved child-to-parent violence would also experience more frequent aggression or more severe aggression that was more, say, physical, for example. We didn't find that. We didn't find that the substance-involved nature of the aggression had a bearing or a relationship to the severity of it, which is surprising, but I guess it's good news as well. But again, to keep in mind here, these are families that are already experiencing a lot of quite severe aggression. So we may have encountered somewhat of a ceiling effect there. So we also did another study with the same sample where we wanted to explore something a bit more straightforward. We also tested the relationship between, or we wanted to understand, I should say, whether the parents' use of substances had any bearing on whether or not the child's parent violence was substance involved. We thought this might be the case because the parents, their own substance use, which might be a way to cope with the experiences of violence that they're having, it might make substances more available in the home, but also be modeled to the young person as a way to cope with what we know are often unstable, high conflict homes. We also know that where there is substance use in the home, generally by anyone, that these homes can be more unpredictable, more chaotic environments for those young people to develop within. And this is a really core mechanism for how child-to-parent violence generally develops. And what we did find was that the parents' use of alcohol, not other drugs, the rates of other drug use was very low in our sample, but their use of alcohol was uniquely related to their experience of substance-involved child-to-parent violence compared to child-to-parent violence that was not substance-involved. So this means that parents who experience child-to-parent violence but also consume more alcohol are more likely to report that their young person is affected by substances when they're being aggressive towards them. And this really aligns with a more family systems, broader perspective of the problem that we'll go into a little bit more detail about now, because it's an important way to conceptualize beyond just the direct effect of substances on behavior to thinking about how substances are impacting on the family system more broadly, which is really important for the child's development course.
So if we were to take a family systems kind of approach to substance-involved child-to-parent violence, and what that means I'll talk more about, but it really requires us to look at the bigger picture and focus on the family system more broadly. And when we do that, we can start to see how substance-involved child-to-parent violence might develop and be maintained and exacerbated within that family system as well. So the first thing we need to know then is, what is this family system? What is family systems theory? So family systems theory tells us that within families, there are multiple subsystems that exist, which are all interdependent on each other. So what we mean by subsystems are basically, we'll talk about dyads here. So there's systems of two people. This might be the parent-child subsystem. It could be, as the image on the slide shows, father-child, mother-child. There is also the parent subsystem, so the system that is just the two parents together. And basically within each of these different systems or relationships within the broader family, there are interactions that occur. And what we mean by interactions are things like there's communication patterns, there are conflict behaviors or conflict patterns, but there are also behaviors that individuals within each of those subsystems engage in, like substance use. And these interactions or behaviors within each of these subsystems then can impact other subsystems in the family. And that's what the family systems approach means by interdependence. Everybody in the family is dependent on things that happen or things that are done by other people in the family. And we look at this through the systems, the different systems impact on each other. So for example, the effect of substance use by one family member can ripple through the broader family system. So if substance use is being engaged in by the parents, for example, and perhaps that leads to some conflict or potentially intimate partner violence, and we know, again, this is something that's quite common in families where there is quite severe child-to-parent violence. This, both the use of substances, the experience of conflict, the intimate partner violence, can what we call spill over into the parent-child subsystem, and it can impact then how the parent and the child interact. And this can also occur because witnessing intimate partner violence can be quite traumatizing for the child, and we know that trauma is also associated with the use of aggression, but it's also modeling behaviors of aggression whilst using substances. So again, the parent-child relationship is going to be impacted by what's happening in the parent relationship as well. Adding to this, the unpredictability of the environment, as Travis spoke about, that is created by substance use, young person substance use, parent substance use, could lead to young persons using substances on an ongoing basis, again, as Travis mentioned, as a way to cope with that really chaotic and unpredictable environment. And this can then increase emotion dysregulation for the young person, which can then impact on the parents, impacts on the parents' relationship, impacts on the parent-child relationship. And so what you can see is that each time any person in the family engages in a particular behavior or an interaction occurs, it has these ripple effects through other parts of the family. Substance use, I guess, also by parents is going to impact on their ability to be responsive as a caregiver. And so if the parent's using substance use, then they might not be able to engage in the parent-child relationship in a way that is the way that's needed to develop really strong parent-child relationship where there's strong secure attachment, where the young person is getting their needs met, essentially. And so the parent-child relationship then can impact on risk over time for the young person potentially using substances to cope or to regulate or to get their needs met that otherwise aren't being met by the parent. So a family systems approach to understanding substance-involved child-to-parent violence is really suggesting that if we want to understand the young person's behavior, we need to understand how it occurs within the family system. And that means understanding the different subsystems and how they're interacting and what impact that might be having for the young person. But it also means that for intervention, we can't really just take the young person out of the family where they need to return to. They, often are young children or young adolescents who will return to the family context. And so removing them to kind of change their behaviors and work on their behaviors in isolation is unlikely to be sort of a long-term sustainable behavior change approach. And instead focusing on understanding the family more broadly and how the family can be supported to make positive changes might actually work really well for this kind of difficulty. And also it might be helpful for the family to feel engaged and involved and to kind of feel like they're contributing. However, that is also, I guess, difficult when you've got families where there are high levels of instability, unpredictability, potentially quite chaotic households, where other people in the family might have their own needs or aggressive behaviors occurring that are also not being addressed. And again, that kind of reinforces why the family approach is so important, to understand what's happening for everybody to support long-term change. So in terms of then what all of this means practically, we've listed out some of the key things that we talk about in our work and that's relevant to some of the work we're doing, but I'm sure all of you are probably thinking of things that are relevant to your own work and your practice as well. But we think that a really key takeaway message from our work is that screening for child-to-parent violence in young people using substances is going to be important, given that these two things are associated. And then really trying to understand the relationship between the two and considering whether there's any impact of substance use on the aggressive behavior in terms of the impact on cognitive function, thinking about what that means for intervention, knowing that cognitive dysfunction, particularly in that frontal part of the brain, will increase the likelihood of aggression, but it will also then impact on how well intervention is going to work, particularly interventions where it's like psychoeducation, for example. It's very hard to learn to remember things, to apply skills if your prefrontal cortex is not working well. But also then for how people can then actually take that information and apply it outside of the intervention. In the real world, you need to be able to draw on that information and actually consider how it applies. And that is a very difficult skill. And it also applies to things like cognitive behavioral therapy, where you need to be able to kind of consider how you felt, what you were thinking when you engaged in the behavior. If you've got poor inhibitory control, you're very impulsive, you can have all of the best cognitive strategies available to you, but not be able to override that impulse to be aggressive. And so it's really important to think of ways to manage that and help young people to manage that when they're using substances and being aggressive. Given that we're talking about substance use here, which kind of looks differently across the cycle, like you've got intoxication, and that's going to have, of course, certain impacts on aggressive behavior. You've also got withdrawal, you've got craving, like if there's dependence. So there's all sorts of different impacts that an addiction or a dependence can have on aggressive behavior, and understanding those differences and what that looks like for a young person can be really helpful. We've done some work with services where like vaping is a really big issue, and trying to understand how the behaviors associated with that might impact on aggressive behavior, and mapping that out can be really helpful. Inter-service collaboration and referral is really important in this cohort. Even though child-to-parent violence is considered typically a form of family violence, the intervention responses needed look very different because we're talking about young people who are still developing. They are often situated in a family context where there are so many factors sitting around their behaviors that are out of their control. And we know that aggressive behavior, or child to parent violence specifically, has different forms. So it can be reactive, it has different forms and functions. So it can be reactive, it can be proactive, it can look different across different ages. So really young children using violence might use different kinds of violence or behaviors compared to older adolescents. And that's the same for substance use. You will see substance use increase as children get older into adolescence. And so the relationships just look different compared to when you're talking about an adult sample. And so there's different considerations, and there are services who work very specifically in the child to parent violence space. Often they're referred to as adolescent violence in the home services. I've put a link on the slide to a national map of services who work in this space. But yeah, it's really going to be important to get that specialist advice on how do we work with young children in this space and understand what role substances are playing. And I guess, again, just touching on a really important thing that we think is key is really considering the whole family in any work in this space. Where possible, looking at family-based approaches, looking at supporting other people within the family, and considering that this might also be really helpful for the broader family and make them feel more engaged and supported throughout the process, but also may help to recognise other things in the family that might be impacting on the behaviours as well. Okay, I am going to stop talking now, but just wanted to thank you all for coming along, and yeah, we can answer questions if we have time.
Thanks, Ashlee, and thanks, Travis. Gosh, really interesting to know that there's not a lot of research in relation to this. So thanks for, I guess, trying to unpack and unpick these things through what you're doing there through the Deakin work. And thank you for pointing out, Travis, very early on there that I think that Pereira definition around child to parent violence, not including substance use. I'm glad that that's something that is being maybe revisited in a way, because it does exclude a lot of things. Look, we've definitely got a few questions popping up, and there's a link that we will put in the chat to that map that you just mentioned, service map. Ashlee, we'll get that out to everybody as well. That's didn't realize that, so didn't know those services were available. So that's important to know. Yeah, look, just a couple of questions in terms of I guess population differences. I know it was 12 to 24-year-olds. Age or gender, any other kind of nuances that came through, what you've seen or the wider research that you've kind of reviewed in relation to this?
I can sort of speak to just our research specifically, and Ash, if you've got anything to add on top of that. So because of our small sample, we didn't look necessarily at those gender differences or age, but we suspect that there would be. We typically see, and we have a PhD student looking at this right now, pretty substantial gender differences. Not necessarily in the rates of child to parent violence. It's actually pretty balanced across young boys and girls, but in some of the risk factors as well. And we suspect that that would translate to this work as well. We actually have a broader sample where we have 5 to 12-year-olds in that group as well. No parents with children that age reported any substance-involved child-to-parent violence. It was only those with children older than 12. Whether we not necessarily say that it's not happening. It might just be much more rare, or it might be that those families aren't necessarily engaging in research as well. That there's some substantial, which is very difficult to say, disruption in those households that means they're not filling out surveys, which is understandable. So we need other ways to kind of engage and understand those families. Ash, did you want to add anything else?
Nothing else from me. That was perfect.
Fine, and I guess this is another question around that kind of population differences, and you may have already answered it with the fact, it's a smaller sample size and you didn't necessarily break it down. But anything that relates to secondary to substance use, young people who are experiencing neurodiversity at all, anything that kind of has shown up or seen kind of any theories about?
Yes. No, it's a really relevant question, that one, and it's something that we look at in our other work as well. So I guess that the rates of young people with most ADHD or a diagnosis of autism are really high in this population. And again, this is an area like the substance involved nature that's not it's beginning to be unpacked, but it's not really right now. And of course, there's a lot of sensory differences in that population that make them more vulnerable to using aggression and violence as they get older. And often the caregiver or the parent is the most proximal figure when they're experiencing that dysregulation, and so it can play out like that. But one way that we conceptualize the development of child-to-parent violence in childhood is that it's often a response to a really unpredictable and uncertain environment where there's either a lot of harshness, so there's a lot of intimate partner violence, sometimes child abuse as well, but there's also a lot of variation in things like the parents' relationship, who's in the home, the parents' employment, the caregiver's responses to the child as well can be really inconsistent. And so a lot of the time the aggression develops as a way to kind of have some control over that, and to manage that unpredictability. And we know that in young people who have autism specifically, but other neurodevelopmental diagnoses as well, there's a really strong preference for predictability, and a general intolerance of uncertainty as well. And so they're particularly at risk because of that environment, basically, is what we suspect.
The intersectionality would be significant in many of those areas. And Travis, I'll just go back to you. I know you mentioned earlier, you saw the question pop up about the proactive aggression. Just, is there anything else that you wanted or needed to say to that specifically?
Yeah, no, my answer is actually the same conveniently, which is so we can, like, for this case as well, this person's mentioned no mental health diagnoses or substance use. Um, it's I guess it's uncommon for there to be no mental health diagnosis because of the environment that they're developing within. But that, a mental health diagnosis doesn't it's not necessary to engage in child-to-parent violence. But that proactive use, so the proactive being that sort of it's not necessarily in response to anything clearly. It's more preemptive, it's more instrumental. That we can see that in the later stages where it's been used for a while and it's become a successful way to get some more control over that environment. And so it's just being used preemptively, or what can appear as preemptive to kind of manage that. And sorry, I'm answering all the questions here, but Ash, please just interrupt me with anything you want to say.
No, that's okay. And I guess this is just a bit of an extension on that from me. And we do have another question that's popped up as well, which I'll get to in a moment. I understand, aggression, violence as aggression, physical aggression, that type of expression is often what's being related to here. But as we're seeing in the I guess adult world, that expansion of the term violence to include things like, damage to property, coercive control, financial kind of threats and management, and those sorts of things. Is that also in any way kind of being picked up, or anything on the radar that you're seeing around that in this area?
yeah, there's a lot of ways to measure the behaviors and um, commonly we just sort of look at physical and verbal direct aggression, but certainly those co-occurring aggressive behaviors like property damage and whatnot, we would consider that certainly as part of this, especially when used as a means to sort of threaten. Um, Ashlee, I've seen you gone off mute, so I'll let you.
Sorry, you could have finished.
No, go
Um,
for it.
I was just going to say, like the meta-analysis that we're doing at the moment, where we're looking at the relationship between substance use and child-to-parent violence. One thing I will note, and we're still finalizing this, but the strongest relationship so far that we've seen is with financial child-to-parent violence. So it is being measured and it is included, and it's actually in this particular population seems to be quite relevant. So yeah, there's definitely stuff out there, and hopefully once we can kind of pull all that together, we'll be able to see some of the key ways it's happening.
Definitely an emerging field. So very good. Just this last question here, we'll take just in the interest of time. Look, I probably won't read it all out, but hopefully you're both seeing it on the screen there. And the question is around the extent that you've explored childhood experiences of domestic and family violence, or in the case of a survey with parents' experiences of interpersonal violence as well. Based on what you know about the strong correlation between childhood experience of domestic and family violence and child to parent violence, I wonder to what extent substance use among these people is also correlated with childhood experience of domestic and family violence or other forms of maltreatment. What implications does this raise for responding to young people using substances and child to parent violence?
Go, Travis. You had your mic on, off.
Okay, we can both answer this one. Look, there's a lot to unpack there. And so, I mean, for this data in particular, we didn't have enough space to measure intimate partner violence. But certainly, there's a really well-established relationship between other forms of family violence in the home and the young person's use of family violence behaviors. That's really clear. And I guess my broad answer to this question would be we need to be really sensitive to the fact that these young people are developing in homes where it can actually be very adaptive for them to be using aggressive behaviors, either in ways to defend themselves early on, and that can then become entrenched and a way to manage other interpersonal conflict or situations. But also just generally in a home where there is this level of I guess chaos. It's not adaptive to think about things too quick, to think about things too slowly or over time. It's adaptive to sort of be more impulsive and to take risks, including aggression and including the use of substances as well as a means to cope with the effects of all of that on the young person, the trauma that they're experiencing. And so I guess the implication, the broad implication of that when we're considering a young person's use of aggression, and we think about child to parent violence in childhood, so pre-adolescence and also in adolescence. The main implication there is that we just have to have trauma-informed approaches, and we have to have approaches that consider that broader family system, and what's happening in the other relationships in the family, and what function is this behavior serving. It doesn't just emerge for no reason. It's functional in some way, and it's functional in a high conflict, really unpredictable environment. Ash, did you want to add anything?
No, that was everything.
Cool.
Thank you. Yeah, thanks for pointing out all those important things. And I guess that's some of that instigator factor. And I was only having a conversation this morning with a good colleague in Dovetail talking about the fact, the notions of children being witnesses to things like domestic and family violence. That's probably really not a particularly appropriate way of considering it when there's that full involvement and all of those experiences are being absorbed in those situations. So no, thank you for for that, I think that's probably a good point for us to end. For anyone who's watching this and would like to share it with any of their colleagues, we will have a recording of this particular presentation up on the website within a couple of days, and feel free to share that as well. Ashlee and Travis, I'm sure you're happy with that as well. But we've popped a link in the chat to the main study from the Drug and Alcohol Review earlier this year that Ashlee and Travis have spoken about and shared with us kindly this morning. So, look, thank you everyone for joining to come along. Just to let you know, next week we'll be back. So that's the Wednesday, the 5th of November, and we have two of our own homegrown people presenting that. That's our alcohol and other drug lived experience educators, Julia and Brett. And they're going to be talking about the release of a online e-learning that's really specifically designed for AOD peer workers around this topic of boundaries, unique to peer workers, but not just for peer workers. I think all other workers who are working in teams and working alongside or managing and supervising peer workers, really important to understand some of the unique challenges and also the ways of responding. But before I go, and I know you've turned off your cameras there, I just really want to say again to Ashlee and Travis, coming to us from there in down in Melbourne, great research, such an important area, and thank you very much both for your time and for preparing for today to share that with us. We really appreciate it. Thank you.
No, thank you for having us.
Thank you, and I hope you've seen all the thanks in the chat coming through as well. Thank you.